Welcome to Cognito Key. Today, we're diving into something that's basically medical magic, anesthesia. We're going to break down the big differences between getting just one spot numbed versus being put completely to sleep. So you'll know exactly what's going on the next time a doctor tells you, don't worry, you won't feel a thing.
I mean, have you ever really thought about it? How is it possible to have a tooth pulled or even go through major surgery and not feel any of that pain? Well, the answer is a true marvel of modern medicine called
Anesthesia. It's a word that literally means loss of sensation, and it's all thanks to these amazing drugs called anesthetics. They're given by highly specialized doctors, anesthesiologists, who can temporarily block pain signals, keeping you safe, sound, and perfectly still.
So, here's what we've got lined up for you. We'll start with why we need anesthesia in the first place, then explore the two main types, local and general. After that, we'll put them head to head. And finally, we'll look at how doctors decide which one is right for the job.
Okay, so first things first. The need for anesthesia is actually pretty simple. For any kind of medical procedure to happen, the patient has to be still and, of course, feel no pain. Let's see how our first type manages this on a smaller scale.
All right, first up is local anesthesia. The best way to think of this one is like a sniper rifle for pain. It's super precise and aimed at just one specific target.
So, local anesthesia works by blocking the nerve signals right where they start, so those pain messages never even get a chance to reach your brain. And that's the key, right? That's why you can be totally awake, chatting away, but feel absolutely nothing in that one little area.
And you've almost definitely had this done before. That little injection at the dentist before a filling? Yep, that's local anesthesia. Getting a cut stitched up, or having a mole removed. All these common procedures rely on this really targeted approach.
And it's not just about injections, Local anesthetics are incredibly versatile. They can be creams or gels that you put on your skin, they can be sprays, or even the main ingredient in a lozenge that numbs a sore throat. The way it's given just changes depending on what needs to be numbed. Okay, now let's go to the complete other end of the spectrum. For those big, complex, major surgeries, just numbing one spot isn't going to cut it. That's when doctors need to bring out the big guns, general anesthesia, which creates a state of controlled unconsciousness. Now, this is a way more involved process. It always starts with a detailed consultation about your health. Then the anesthetic is given, either as a gas you breathe in or through an IV. But the most critical part? Constant monitoring. An anesthesiologist is watching your heart, your breathing, your blood pressure, every single second. And because it affects your whole body, the recovery takes a lot longer too. Since general anesthesia works directly on your brain, waking up can feel, well, a bit weird. It's common to feel nauseous, dizzy, maybe a little confused as your brain slowly comes back online. But don't worry, the medical team is right there to manage all of this and make sure your recovery is as smooth as possible. Okay, now that we know a bit about both types, let's put them side by side. This is where the differences really pop. And here it is, the most dramatic difference of all, consciousness. With local anesthesia, you're awake. With general, you are completely unconscious, in a deep but reversible sleep. You won't remember a thing afterwards. The other huge distinction is the area of effect. Remember our sniper rifle? That's local, precise, targeted. General anesthesia is more like a blanket. It covers your entire body, including your brain and your whole central nervous system.
This table really brings it all home. See where it says site of action? Local targets the peripheral nerves. Think of them as the wiring in your body. But general targets the central nervous system, your brain itself. And that one difference explains everything else on the chart. Why one's for minor procedures and the other for major ones, why the risk level is so different, and why recovery can be just minutes for local versus hours or even days for general.
So, how in the world do doctors decide which one to use? Well, it all comes down to choosing the right tool for the right job, always keeping the patient's safety and comfort as the top priority.
It's a really careful calculation. Are you just getting a few stitches on your finger? Local anesthesia is perfect for that. But a 6-hour open-heart surgery, that absolutely requires the total body control you get from general anesthesia. Of course, the patient's age and their overall health are also huge factors in making that call.
And this quote really highlights the difference in complexity. A surgeon can often give a local anesthetic injection themselves, But general anesthesia is so powerful and complex that it demands a dedicated specialist, the anesthesiologist, whose one and only job during the surgery is to manage your unconscious state and keep you safe.
Which brings us to the future. As we learn more and more about our nervous system, what's next? Could we one day have anesthetics that target individual nerve cells and have zero side effects? It's a really fascinating thing to think about.
Thanks so much for joining us for this explainer here on Cognito Key. If this helped clear things up for you, please do us a favor and like, share, and subscribe for more explainers that break down complex topics just like this one. We'll see you next time.